And the 2020 Tokyo Olympic Summer Games have officially been postponed to sometime next year. And coming up, as mentioned, we're going to be talking with Dr. Iris Gorkfinkle, so be sure to send us your questions. You can get your questions to us by sending us an email at cbcnewsvancouver@cbc.ca or by calling the telephone number on your screen there, 604-662-6801. And if you're watching on Facebook or YouTube, you can post your questions there in the comments section, and we will get to those in just a few minutes. And we do want to look ahead to tomorrow. We've got a session at this time focused on children and self-isolation. Dr. Shimi Kang, an expert in mental health, is going to be joining us for Wednesday's live Q&A session. So you can send us your questions even now by calling the numbers on your screen. Email, you know the routine in terms of getting hold of us and leaving us questions for either Dr. Gorkfinkle today or Dr. Kang, and that'll be coming up tomorrow. All right, let's get more on the BC numbers we just mentioned to you today and what we can expect going forward. Our Dan Burrett joins us once again now live with more on this. And Dan, we've seen, I know there was some discussion about how they're tabulating the numbers over the past couple of days, but there has been a surge in cases.
Yes, that's correct. 145 new cases, as you mentioned, Mike, but they're from yesterday and today, so that's 2 days worth of numbers. No new deaths are being reported, thankfully, although, as we know, we've lost 13 people, 10 of them linked to the Lynn Valley Care Centre in North Vancouver. And 2 more long-term care homes now have outbreaks. One is Little Mountain in Vancouver Coastal Health and Evergreen Heights in Fraser Health. Most of the cases in BC, though, are concentrated in Coastal Health here in Metro Vancouver. But Dr. Bonnie Henry knows they know COVID-19 is moving throughout our province. Another piece of positive news we ought to mention. Henry says 173 people have fully recovered, almost 30% of all of our cases. Still, Health Minister Adrian Dix notes more people are being hospitalized. We're going to see those numbers go up, and he says it's going to get tougher. So, physical distancing now not an option.
Next few weeks will be very, very difficult. It will be some time before we see the change we are all working towards. But what happens today matters in that change. What matters today matters in April and in the months that follow that.
Dix notes the province is doing 3,500 tests every day. We've done about 30,000 overall so far. The province has also freed up thousands of hospital beds by canceling elective surgeries across the board. Just over half of our critical care beds are now full. So we are going to see those numbers rise, according to the health minister.
Yeah, for certain. And Dan, a lot of people have been wondering why the province isn't testing everybody. What did Dr. Henry have to say about that today?
Yes, we heard from the WHO about the test. Henry says they were following international testing rules. Essentially, people with symptoms of COVID-19 who had traveled outside Canada are not being tested because they figured out that that's where they know the source of that infection. And that frees up tests for community traces here where we cannot trace the source, where we don't know where the source of the infection is. She stresses they are testing and contact tracing anybody where the source of their infection is not clear. And later this week, we're going to find out how BC is doing compared to other regions.
We have been looking at comparing our outbreak with what's happening around the country and around the world. And later this week, we'll be presenting some of how we're using that to understand how we need to be prepared, but also to understand how our curve is progressing over time with some of the modeling that we're doing.
Henry again stresses if we physically stay apart, she used the words physical distancing today, not social distancing. If we stay apart, we can flatten the curve and stop our healthcare system from being overwhelmed. She says they want cases to come in a trickle, not a flood. Mike.
All right, Dan, thanks very much.
You're welcome.
Latest on the COVID-19 situation in BC today. Dan, thank you. All right, we are now going to move to our question and answer session where we're going to take your COVID-19 questions to the experts. You can ask over email, by phone, or contact us on Facebook, YouTube, or Twitter. We're going to try to answer as many questions as we can. We've got plenty of time this afternoon. So joining us once again is Dr. Iris Gorkfinkle. She is a family physician and vaccine researcher in Toronto. Dr. Gorkfinkle, thanks again for joining us this afternoon. We appreciate it.
Thank you for having me, Mike.
Well, let's get to some of the questions here. I know that vaccines are one of your areas of expertise. So here's a question from several people on Facebook asking, what is the status of a possible vaccine?
It will take time for us to develop a vaccination. Estimates, and they're conservative estimates, are 18 months. And the reason for that is we have to develop serological testing first. In other words, we have to be able to identify the antibodies in a person to make sure that they are, in fact, responding to the vaccine. So that's step one. And then step two is the development of a successful vaccine. And just to test that, it will take real time.
Okay, here's a question from YouTube, a good one. Is the flu season, yes, the flu season, is it over? If I get sick, can I just assume it's COVID-19?
Well, let's put it this way. Last year's flu season ended on May 25th. It's actually later than people realize. And while we're hoping that the warm weather will help turn things around, this is a new bug. It's a new virus. So it remains to be seen if, in fact, the warm weather will be a positive harbinger for this. We're hoping it will be, but we'll have to see. Time will tell.
Okay, as you may have heard, we have 173 people here in British Columbia. 28% of the overall cases have fully recovered. Dr. Bonnie Henry was talking about that at her briefing earlier today. And I know she was asked this question as well, this one coming from Norma on Facebook, asking, once a person has recovered and is released, considered fully recovered, are they still able to be reinfected?
You know, that's the million-dollar question. Will they be? Time will tell us with certainty. But what we know from other viruses, other coronaviruses, is that the virus can undergo shifts and changes. The proteins on the coat can change over time, either completely or just subtly. And when that happens, that could be a new strain. Now, will it be as virulent? We don't know. How many times will this happen? We actually don't know. So some things we just have to own the fact that we're ignorant about and that time will have to tell us.
All right, another question from YouTube asking if gender is a factor when it comes to COVID-19.
I am not aware that gender makes a big difference. There were some statistics initially coming out suggesting that if you were male, it was a little more likely to be a problem. But I think overall, the statistics show that the people who are most heavily hit, it's just a matter of age and chronic conditions. That seems to be the best predictor of who's going to be in deep doo-doo if they get this.
Okay.
Yeah, well, what are you going to say?
Yeah, well, you say what you say. All right, a viewer, this is a question actually on YouTube. Does obesity generally increase risk of this virus being fatal?
What's interesting about obesity is that it holds hands with other problems. So obesity increases inflammation in general in the body. And obesity is a marker for diabetes, which is a known risk factor. So I don't know if it does it directly or indirectly, but certainly being grossly overweight is not in someone's favor.
All right, here's a question on Facebook from Norma asking if COVID-19 can be transferred through mosquitoes.
No, there's no evidence that it's transferred through mosquitoes. We believe the primary mode of transferring it is through small droplets. So in other words, somebody coughs, laughs, sneezes in your face, and we think that it transmits up to 6 feet. And that's why that social distancing is so important. I'm going to use this as an opportunity to jump in with an interesting study they did out of Singapore. Absolutely fascinating stuff here. They found, and this was just published in The Lancet, that social distancing, that physical distancing of 6 feet, 2 meters, it cuts the cases by, guess this amount, 4 times. We would see 4 times the number of cases if people did not do that physical distancing. That's an incredible figure.
It is. 6 feet for 4 times is staggering, really, and it's nice to see. We're looking in our community now. I know you're in Toronto, but you probably saw some of the images from Vancouver over last weekend. It was a beautiful weekend here, and people were gathering in large numbers at the beach and in parks and what have you. But even in the last couple of days, people seem to finally be getting that message of social, of physical distancing. So that study out of Singapore is certainly encouraging. Let me get to some more questions here. In terms of treatment, Andrea on Facebook is asking, how about high doses of vitamin C, or maybe even as a preventative measure?
There is no evidence that vitamin C makes a difference, and not only for COVID, but we don't know that it makes a difference for any regular colds as well. It's a common thing. People used to say, oh, you take the vitamin C, you'll prevent the cold or you'll treat the cold. We don't have any cures for common colds, nor do we have any effective treatments. It's interesting you mentioned the exercise piece. We know that exercise actually does help the body's immune system, both directly and through allowing a person to sleep not only more, but better quality sleep as well. And that also has proven immune benefits.
Okay, here's a question from Andrea on Facebook. From Stephanie on Facebook asking, will products like Reactin antihistamines provoke COVID-19?
I don't know of any studies suggesting that if you take Reactin, it's going to make things worse for you.
Okay, here's a question from YouTube. Are there antibody tests coming on the market now? And if so, when might they be available in our country?
We are not aware of any antibody tests that have yet been developed. That is definitely one of the golden gooses we're after. That's a huge thing. If we have antibody tests, that could allow us to make what's called a passive vaccination. In other words, if we can gather those antibodies together and inject those antibodies into somebody who's very sick, it may actually help. That's called passive immunity, and that's been done successfully with other diseases. So that's a potential inroad, but so far we don't have it yet.
All right. Jessica sending an email to ask, is there any more research being done on how this virus affects pregnancies, mothers and babies?
That is watched very carefully. We know that, in fact, pregnancy is a slight immunosuppressed state, and women who are pregnant are at risk of influenza and are advised to get the flu shot. That does not appear to have been a strong signal for this particular virus so far. But because of the changes that we're seeing in it, in fact, this virus has mutated, we know that. We're watching that very carefully. Every country is watching the numbers we see very carefully.
Okay, and let me get to, this has been a source of considerable controversy for a number of reasons over the past few days. Severino on Facebook asking, and I'll probably butcher the pronunciation, but we know others have as well. Will hydrochloroquine really work in suppressing the symptoms of COVID-19? I know there's been discussion of that being used with another drug, and in some cases it hasn't turned out well for people.
Unfortunately, hydrochloroquine has not been proven to be effective against COVID-19. Ongoing studies are needed, and it is not a recommended therapy at this time.
Okay, and we do apologize for the video quality. You're a little washed out at our end. We'll take the blame for that. I don't know if there's anything we can do at your end, but we can hear you fine, and your answers are great. So we're just going to keep plugging away here, but we wanted to acknowledge that. Question on Facebook from Graham, Dr. Gorkfinkle asking, how long before a patient with COVID-19 might need an ICU bed?
Okay, so most of the cases, we're talking about 85% of the cases are mild, meaning it'll be like a cold. A person can go about and do their regular activities. Now, if you look at that last 15%, that's what this whole song and dance is about, the social distancing, because it's that 15% that we worry about. So of that 15%, 5% need an ICU bed, and that's actually very concerning because we don't have enough ICU beds. On average, we have one bed for 10,000 people, and many of them are already occupied with other things. And that's why these preventative measures are super important.
Okay, here's another one from Jacqueline wanting to know, when will the part of the testing criteria involving whether or not a person has traveled or come into contact with someone who traveled and was diagnosed with or tested positive for COVID be removed? We know that there's community spread, so keeping that as a criteria seems out of place, at least at this point.
So I'm sorry, the question was?
Yeah, so I'll repeat it because I know we're trying to make some adjustments with your camera at that end. From Jacqueline wanting to know, when will the part of the testing criteria involving whether or not a person has traveled or come into contact with someone who traveled and was diagnosed COVID positive, possibly be removed?
I do not know for certain when that will be. I think that'll depend on the numbers. But I have to tell you, I am so proud. If you look at the sheer number of tests we've done in Canada, you know, we've just exceeded 100,000 tests. And we're now pushing 10,000 tests a day Canada-wide. That is absolutely incredible. And so I'm excited that we'll develop systems that will allow us to not only identify people who with relatively fewer symptoms, I'm hoping we'll move in that direction, but also develop fancy systems that will allow us to electronically contact contacts and place them in isolation. That's what that's one of the tactics the most successful countries have used.
All right, Dr. Gorkfinkle, stay with us for just a bit. We're going to try to get your the technical situation sorted out at your end, but please stay with us. I'll get our folks to touch base with you. In the meantime, we're going to get a check of weather. And that would be time for Brett Sonderholm to join us now with quick check of the forecast, but also the Avalanche forecast situation.
That's exactly right. We're going to stick with the theme here of COVID-19 because I know that this is on so many people's minds, and it's not necessarily something you think about here, but when it comes to avalanche forecasting, this is actually being impacted right now by COVID-19 along with everything else. I mean, you can just see some of this imagery here. Avalanches, of course, one of the most dangerous forces of nature that we have to deal with here in BC as well as Alberta. It is a scary situation if you ever find yourself in one of those, and as a result, Avalanche Canada, the head organization in charge of putting out all the forecasts, has had to make the really tough decision to suspend forecasts for the remainder of this year. Now, this situation, this decision that they made was not done lightly, of course, because they know how essential this service is, but they did do this for a couple of reasons, and keep in mind, this is going to be as of March 28th. So if you're a regular person who goes out into the backcountry, or maybe you know somebody that does, checking avalanche.ca, that is your lifeline to see whether or not you're going to have a good time out there, if it is safe to go. But unfortunately, they are shutting down a whole month early, and this is because they require personnel. They actively hire their staff to go out, and professionals will monitor the conditions for avalanches. And now that is just not going to be safe for any of those professionals to do. As a result, there's not going to be enough data. So when they are giving a forecast, they're operating on far fewer data points, and that makes it really tough to see how safe or not it is actually to be out there. And of course, the main thing with this, of course, to keep in mind is that we're just trying to encourage people to be staying home. Just because you maybe are working from home or not going into the office doesn't mean you should still be climbing mountains and going outside. That's putting everyone at risk and could potentially burden our healthcare system even more. So they've made this very tough decision. As of March 28th, that is going to be the last forecast. But as of right now, this is through Thursday. It is still up to date, though they do recognize that there are a few data points that are missing. You can see, though, across much of BC, the avalanche danger rating is anywhere between moderate and low at this point in time. The only exception is going to be actually on the other side of the border in the southwestern portion of Alberta. But that said, conditions are going to be changing across the province. And if we just take Vancouver as an example, we're going to be going into a much more unsettled pattern as we get through the next few days and into the weekend. That's, of course, going to be destabilizing the avalanche pack, or I should say the snowpack, rather. So I think it's just a really good thing to keep in mind here. Just don't be considering going outside to the backcountry at all, and you're no longer going to really have the support of any forecasters to help you out there. So just a further testament of how COVID-19 is reaching in places that we didn't even really think it was going to be.
Well, thanks for bringing us that intro, Brett. We appreciate it.
You're welcome.
All right now we're going to bring back in Dr. Iris Gorkfinkle, family physician in Toronto and a vaccine researcher. Look at that. That's a much better image of you, Dr. Gorkfinkle. Thanks for hanging on, and thanks for taking some more questions. This one appropriate, considering what Brett has just been talking about. Robbie wants to know, do we know if the weather affects the spread of this virus? For example, when things get warmer, might things get a little better?
We are keeping our fingers crossed on that one. It is not a given that just because the weather will be warmer, we'll see fewer cases. But we are hopeful, because that's certainly been the case for influenza, that when it warms up, there seems to be less viral replication in the nose. But it remains to be seen if that's going to be the case with COVID-19.
Okay, here's a question from Janet on Facebook asking, is it safe to go out without a mask?
Is it safe? Well, let's put it this way. I took my walk this morning, 5 miles, no mask. Masks do not help people who are not infected. They do help prevent the spread. When somebody is known to have the disease, it stops them from spreading the infection. Plus the fact, if we're practicing that 6 feet of physical distancing, that 2 meters, we shouldn't need it.
Okay, here's a question from Raza on Facebook asking, is 0 new cases for 3 consecutive weeks the goal to be in the clear? I know there's been a lot of discussion about how long do we have to continue these measures that we're taking?
The goal is not 0 new cases. I don't think that's even realistic. You look at how fast the cases are coming up right now. Clearly, we are at the point at which we are still climbing the curve. So how long, and this will be up to epidemiologists to decide at what point should we return back to work? At what point will social distancing measures no longer be required?
All right, here's a question on YouTube. I used to have asthma, but I still have to go to work. If I'm staying 2 meters away from people and keeping up with good hygiene, and I'm otherwise a healthy young individual, how big of a risk do I face?
If the asthma has never caused you to have a hospital emergency visit, or, basically you've been pretty healthy, you're not requiring puffers on a daily basis, the use of inhalers, chances are your asthma is mild enough that it would not represent a serious risk. We doctors, we're very simple folk, actually. We basically look at the past and we say, okay, has this person been hospitalized before? Have they been in an ICU? Have they been to an emergency room lately? And that's actually the metrics we use to determine just how sick they're likely to be with future infections. That said, there's also a group of asthmatics who underestimate their symptoms. So ultimately getting checked by a doctor, having the proper pulmonary function testing, if there is doubt about it, is the way to go.
Dr. Gorkfinkle, we really appreciate your time once again today. Thanks so much.
It's always a pleasure.
All right, Iris Gorkfinkle, Dr. Iris Gorkfinkle, family physician and vaccine researcher in Toronto. Okay, we're going to be back online here and on CBC television at 6 o'clock tonight with a local newscast. We'll bring you the latest stories related to COVID-19. We're then going to hand things over to my regular co-host, Anita Bath, as she brings you live updates on the pandemic on The National. You can always find our news program online at cbc.ca/BC and stream it on CBC Gem. For now, stay healthy, stay safe, and if you can, stay at home.